With less than a week to go for the Cricket World Cup to unfold in Bangladesh, GAIN, the Global Alliance for Improved Nutrition, stepped up its efforts to build on local momentum to drive innovative partnerships to improve maternal and child nutrition in Dhaka. The discussion was attended by representatives of government ministries, international organizations, NGOs, academia and business involved in the fight against maternal and child malnutrition. It focused on a locally driven initiative that is making marginalized populations access improved nutrition through an innovative public-private partnership, harnessing markets and far-reaching distribution channels. Renata Limited, a pharmaceutical company, and the well-known NGO BRAC are working together to enable more than 50% of children in Bangladesh access the nutrition necessary for them to live to their full potential. The executive director of GAIN, Mark van AMERINGEN, spoke of the need for such partnerships to change the dreams of Bangladeshi children.
We're meeting at a time when there really is a serious threat to food and nutrition security in Bangladesh. Partnering with the private sector is a big part of what GAIN does. We're not advocates for the private sector. We see the private sector as a key stakeholder who needs to be at the table, and they've often been excluded from the nutrition sector. But our interest in the private sector is really how do we make markets work better for the poor, so poor have products that they can afford.
Dr. Rajan Shankar, the regional manager and special advisor GAIN South Asia Regional Office, presented the scientific studies that show that strategic interventions could make a big difference in reducing malnutrition.
Child undernutrition is actually a global crisis. It's a global crisis because close to 3.5 million child deaths are directly attributable to undernutrition, which is eminently preventable. Many developing countries, including Bangladesh, continue to have high rates of malnutrition, which really threaten the health and well-being of the whole population. So what are the solutions? The tragedy is the solutions are very simple. There are several well-proven, cost-effective, simple interventions, and many of them are compatible with simple primary health care approach. If we have to, just to name a few that are, to say, in the infant and young child nutrition area, is optimum breastfeeding, complementary feeding, and strategies to reduce micronutrient deficiencies in this age group, and some early child development interventions can rapidly reduce the rates of malnutrition.
Elaborating on US government's 1,000 Days campaign, Cindy Huang, Senior Advisor to the Office of Global Hunger and Food Security Initiative, U.S. Department of State, shared Secretary Hillary Clinton's perspective too.
Nutrition is critical, and it's critical to the development of countries, to the development of individuals, children, and it really is a true investment in our future. And that's why, for the United States, nutrition is at the intersection of the Global Health Initiative and the Feed the Future Initiative. So what is 1,000 days? As many people have discussed, it's the critical window of opportunity for development. But Secretary Clinton had another challenge, and she said this is also a window of opportunity. Let's take the next 1,000 days as a call to action to see if we can jumpstart action, cooperation, and partnerships. And so we're looking at how can we work with SUN, the over 100 stakeholders have endorsed the framework, and really start working at the country level.
FARUQUE Ahmed, BRAC Director, spearheads the largest health program and was optimistic of meeting the challenges of reaching the poorest of families through its network of 80,000 Shasta Shebikas or community health volunteers.
We will be facing a huge challenge. So I think if we can partner with this partnership approach, we have an army of community-based workers who are in the community, they come from the community. More than 80,000 health volunteers are working in the community level. Our infrastructure we call essential healthcare. Basically, it's an approach of all MARC principles. We're doing it. We educate them, we train them, they visit households, they deliver health products, they provide both preventive, promotive, and limited curative care.
Kaisar Kabir, CEO and MD of Renata, shared his agony of tackling the hidden hunger of Bangladesh. The company markets Pushtikona, single-serving sachets of vitamins and minerals, through its network of medical sales representatives.
46% of children in Bangladesh suffer from micronutrient deficiency. So when Renata got into this project, we thought of taking a holistic approach and not just a product-based approach to combating hidden hunger.
The Renata BRAC model provided a platform for participants to discuss how they could collaborate to scale up similar high-impact solutions locally, regionally and globally to end maternal and child nutrition. GAIN collaborates with a gamut of partners in Bangladesh to implement a broad range of interventions that support national nutrition programs, and with a new country office and manager for Bangladesh, we are geared to meet the challenges head-on. The chairperson of GAIN, NAIDOO, couldn't have expressed it better when he said it is eventually up to the people of Bangladesh to make a change in the lives of its children.
That the solution to solve our problems at a country level is in the hands of people that live in those countries. All we can do is try to understand where you are in your struggles, what is the challenges you face, what are the resources you have, and we can try to be a catalyst, to come and listen first of all, and then work together with you to find solutions. And what GAIN comes with is really an understanding of some of the best practices in the world. It's able to bring that from a global marketplace and bring it down to a country level. But essentially, to find the solutions to the problems you face is in your hands.